So exercise is an interesting point, and I have respiratory therapists that love to drill me and talk to me about this because I'm not the best at exercising, not gonna lie. But exercise is really good for people with CF, actually. It's just like anyone with a heart condition is gonna work up to improving the muscle. Anyone with the lung difficulties we have is improving the lungs as they exercise. So they really like you to exercise a lot. And I've been part of various different programs and different things like that to get you to exercise. And I know my friend Summer Love is really into advocating exercise and things like that. A lot of patients with CF have to wear oxygen when they exercise. In fact, that's something I probably should have brought up. I wear oxygen at night, and then if I'm sick, I wear it more during the day. So there have been times when I've taken an oxygen tank to work, but most of the time I don't have to wear oxygen. But a lot of us have to wear oxygen when we work out because the oxygen levels just decrease so rapidly. And so it's more of a pain to exercise, frankly, right? Because you're not like, it's hard to go jogging with this thing on your back that you're like boom, 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 against you. So you have to be creative on how you exercise. But exercise is definitely a good thing. Now, I will say, I also have friends that have chronic fatigue and CF. So they have the double CF is what I call it, because, you know, you've got two different CFs, right? But it makes it really hard to exercise because if you do high intensity exercise, your body just hurts and it's really hard. You're really tired. Obviously, you're going to be tired anyway if your body's not at 100% and you're trying to exercise, right? Anyone who's sick and tries to exercise can understand that. But especially those with chronic fatigue have a really hard time balancing out things. And I know a lot of them do yoga, and they even take their mats to the hospital with them. I took my yoga mat to the hospital this last time, and I was like, oh yeah, this is great. So I know I have a couple of friends that definitely do a lot of yoga to help because it's not super high intensity exercise, but it's still exercising enough that it's helping you with your endurance. So exercise is definitely one of those things that has to be done on kind of a personal level as far as how much you can handle. And has to be done kind of creatively, but it's definitely something that the doctors recommend as well. So.